Next speaker is Dr. Harvey, and the topic is comparison of image review parameters from two different optical coherence tomography analytical workflows.
Good morning. I'd like to thank the organizers for the opportunity to present this. We do receive research grants from ZEISS. The most valuable resource of an eye clinic is likely the time of the doctor. And these days in a retina practice, we spend a considerable amount of time looking at OCT images and injecting medicines into the eye. We started out using print images, and these images were very useful because they gave us an idea of the disease activity, response to treatment. There are biomarkers that tell us that predict how well the patients will do, and therefore, by incorporating this, we now enter the age of personalized medicine. Print images are not very efficient because it's time-consuming to review them, especially if there's a large number of temporal images to view. They're also hard for patients to understand, and they're prone to delays and errors. If your printer breaks down, then you'll have to wait until you repair the printer. And more recently, digital systems have allowed us to simultaneously view all of the images from the patient's first visit, visualize the patient's response, and even quantify how well patients respond to the treatment. So we wanted to compare digital and print analog workflows in the management of eyes being treated with intravitreal injections. We gathered 10 trained retina specialists, and we had them review image sets. Half of them reviewed print images first, followed by digital images, and the other ones, the digital followed by the print. And then, based on the last image of each image set, the doctors would have to make a decision whether to treat or not to treat. And we timed how long it took the doctor to review the image until the time they made a decision whether to treat or not to treat. So the print materials, these were 30 sets of OCT print images from eyes with requiring IVI medications, and they were chronologically arranged. The name of the medicine given was indicated on the page where the treatment was actually given. And on the last page, this was deliberately left blank, and the rater had to make a treatment decision. For the digital image, we used the ZEISS Retina Workplace software. And in this software, the reviewers looked at the same 30 image sets. And in this system, you can see on top the macular thickness map. In the middle here, you can see the B scans. And then on the bottom, there's a graph that shows the central retinal thickness, the average cubed thickness, the injection date, and the type of medicine that was given. And on the last visit, the doctor would have to make a treatment decision. These were our key measures. So I found that there was a significantly shorter review time when doctors used the digital workflow to review the images versus the print format. And the reduction was quite significant. It was almost 50% reduction. So if it took a minute to review an image set using the print format, it took half a minute using the digital format. And if you have to look at 50 patients a day, this could add up in time savings. In terms of treatment decision agreement rate, interestingly, the agreement rate was only 71%. That means in 29%, a different decision was reached by the doctor who looked at the print image, and then later he looked at the same digital image set, but a different decision was made. The treatment decision confidence level, this was self-rated, was higher using the digital workflows. So this is an example. On the left, you can see the print image, and on the right, you can see the digital image of the same patient, but a different treatment decision was made. This is another patient where on the left, it took 103 seconds to review this rather extensive history patient. On the right, 82 seconds. So there was a significant decrease in time, but the same treatment decision was made. The raters overwhelmingly rated that the digital workflows were more easy to use. So imaging is now an essential part of retina practice, and in this part of the world, at least, there's still many practices that use print images. Um, this study probably underestimates the time savings because we didn't factor in the time it took to print the images, collect the images, and submit the images to the doctor for review. So differences in treatment decisions might be related to the ability of the doctor to figure out what's the dosing regimen based on print images. But on the digital images, you can clearly see here on the upper screen, this is more of a fixed interval treatment dose. And on the bottom screen, a treat and expend treatment dose was being used. And this is very easy to see on the digital workflow, but not too easy on print workflows. So in summary, digital workflows are more time efficient than analog or print workflows for reviewing OCT images. Digital workflows raise physician and patient confidence. They definitely enhance physician productivity and satisfaction, but whether a system is good for your practice will depend on a cost-benefit analysis. Thank you very much for your attention. These are my co-investigators, two of which are here, and we invite you to Manila in December for the AP VRS. Thank you.
Thank you, Dr. Hui.